Good morning, Dr. Nancy Palermo from Thrive Healthcare with your Motivational Monday. So February is Heart Health Month, but when you listen to the statistics, every month needs to be Heart Health Month. In 2018, over 800,000 people died of heart disease or its complications. That's 1 in 3 deaths. And we spent over $300 billion trying to treat heart disease with really no long-term or successful effects. Here's the motivational part of this. 80% of heart disease is preventable. And so at Thrive, prevention is one of our focuses. We want to get to the root cause, and we want to help prevent disease instead of going down the path of disease. So we are taking heart health seriously. In fact, we're going to be piloting a cardiometabolic fix, which is an 8-week program to help address some of the preventable causes of heart disease and vascular disease. There are over 400 risk factors for heart disease, and most doctors' offices can only address some of the few. For example, a lipid panel, what everybody gets every year, only detects a small percentage of people with heart disease. In fact, 50% of people who have a heart attack had a normal or fairly normal lipid panel, so this isn't picking up who's at risk. We are going to address small changes over the next week that will help you introduce some of these preventative measures into your lifestyle. If you can't sign up for the 8-week program, you will also be able to make the changes and see some benefits. This week, I'm going to talk about essential fatty acids. So these are like the fish oil, your DHA and EPA, but also GLA, which is gamma linolenic acid. These are all extremely anti-inflammatory. I say they're kind of like the aspirin a day without any of the side effects. So essential fatty acids are anti-inflammatory, they reduce platelet clotting, they increase HDL, which is your good cholesterol, and decrease LDL, especially small density LDL and triglycerides. These are huge benefits. The other thing that makes essential fatty acids so beneficial is that they decrease prostaglandins, which are inflammatory substances that are believed to be related to heart disease and many other disease processes too. You see, when you address these underlying preventable risk factors, you're not just preventing heart disease, you're preventing a number of other medical conditions. So when we make recommendations for essential fatty acids for disease prevention and heart disease prevention, we recommend anywhere from 2,000 to 3,000 of the essential fatty acids. So that's including the EPA, the DHA, and the GLA. So hopefully that's a good tip for this week, and listen up for the next coming weeks for some more helpful hints.